What is a headache? Migraines are an exceptionally normal condition that the vast majority will encounter ordinarily during their lives. The principal side effect of a migraine is torment in your mind or face. There are a few sorts of cerebral pains, and strain migraines are the most widely recognized. While most cerebral pains aren't perilous, specific sorts can be an indication of a serious hidden condition. Types of headache. A headache is an aggravation in your mind or face that is much of the time portrayed as a strain that is pulsating, steady, sharp, or dull. Migraines can vary significantly concerning torment type, seriousness, area, and recurrence. Migraines are an exceptionally normal condition. Headache are an exceptionally normal condition that the vast majority will encounter ordinarily during their lives. They're the most widely recognized type of agony and are a significant explanation referred to for a really long time missed working or school, as well visits to medical care supplier. While most migraines aren't perilous, specific sorts can be an indication of a more difficult condition. Migraine. Hypertension. Cluster. Stress. Sinus. Primary headaches. Brokenness or overaction of agony. Touchy highlights in your mind cause essential cerebral pains. They're not a side effect of or brought about by a hidden ailment. Certain individuals might have qualities that make them bound to foster essential migraines. Types of primary headaches include tension-type headaches. Most common type of headache. Migraine headaches, cluster headaches, new daily persistent headaches, and VH. Alcohol, particularly red wine. Certain foods, such as processed meats that contain nitrates. Food-triggered headaches. Consuming nicotine headache. Changes in sleep or lack of sleep. Poor posture. Physical activity, such as exercise exertion headaches. Skipped meals. Hunger headache. Coughing, sneezing, blowing your nose. Straining, such as when having a bowel movement, or laughing or crying vigorously. Primary cough headaches. Secondary headaches. A basic ailment causes auxiliary cerebral pains. They're viewed as a side effect or indication of a condition. Kinds of auxiliary cerebral pains that aren't really perilous and resolve once the hidden condition is dealt with include dehydration headache, sinus headache, medication overuse headaches, spinal headaches. Spinal cerebral pains are extraordinary migraines that happen when spinal liquid holes out of the layer covering your spinal rope, normally after a spinal tap. Most spinal cerebral pains can be treated at home, yet delayed. Untreated spinal migraines. Untreated spinal migraines can cause perilous confusions, including subdural hematoma and seizures. Thunderclap headaches. A thunderbolt migraine is a very excruciating cerebral pain that comes on out of nowhere, similar to an applaud of thunder. This sort of migraine arrives at its most extraordinary aggravation in the span of 1 moment and endures something like 5 minutes. While thunderbolt migraines can at times be innocuous, looking for surefire clinical attention is significant. They can be an indication of head injury, brain bleed, reversible cerebral vasoconstriction syndrome, a sudden, severe rise in blood pressure. What's the difference between headache and a migraine? A headache is a kind of essential migraine problem. A headache is a typical neurological condition that causes different side effects, most outstandingly a pulsating migraine on one side of your head. Headaches frequently deteriorate with actual work, lights, sounds, or scents. They normally last somewhere around 4 hours or even days. Symptoms and causes. What is the main cause of a headache? Migraine torment results from signals connecting among your cerebrum, veins, and encompassing nerves. During a cerebral pain, numerous systems enact explicit nerves that influence muscles and veins. These nerves convey torment messages to your cerebrum, causing a migraine. Are headaches hereditary? Cerebral pains will more often than not run in families, particularly headaches. Youngsters who have headaches for the most part have no less than one natural parent who likewise encounters them. As a matter of fact, kids whose guardians have headaches depend on multiple times bound to foster them. Cerebral pains can likewise be set off by ecological elements partook in A's family, for example, eating certain foods or ingredients, like caffeine, alcohol, fermented foods, chocolate, and cheese. Exposure to allergens, secondhand smoke, strong odors from household chemicals or perfumes. What headache side effects require prompt clinical consideration? Assuming you or your kid has any of these cerebral pain side effects, move clinical consideration immediately. An unexpected, new, and serious migraine. Cerebral pain with a fever, windedness, solid neck, or rash. Cerebral pains that happen after a head injury or mishap. Getting another sort of cerebral pain after age 55. Likewise, look for clinical consideration immediately on the off chance that your cerebral pain is related with neurological side effects. For example, shortcoming, discombobulation, unexpected loss of equilibrium or falling, deadness or shivering, loss of motion, discourse challenges, mental disarray, seizures, character changes or unseemly way of behaving, vision changes, hazy vision, twofold vision or vulnerable sides. What the migraines feel like. How frequently the cerebral pains occur. How long the migraines last each time. How much torment the cerebral pains cause you. What food sources, beverages, or occasions trigger your migraines. How much caffeine you drink every day. What your anxiety is. Condition that might be causing the migraine, including fever, disease, hypertension, muscle shortcoming, deadness or shivering, unreasonable weakness, loss of cognizance, balance issues and successive falls, vision issues, foggy vision, twofold vision, vulnerable sides, mental disarray or character changes, seizures, unsteadiness, queasiness and spewing. How might I dispose of a headache? You can treat an intermittent, gentle migraine at home with over-the-counter painkillers. Other taking care of oneself medicines for cerebral pains include applying intensity or cold packs to your head, doing extending works out, kneading your head, neck, or back. Only 1 out of every odd migraine requires drug. A scope of medicines is accessible, contingent upon your cerebral pain type, recurrence, and cause. Treatment choices include stress the board, biofeedback, drugs, treating the fundamental ailment or cause. How tests will be analyzed. Migraines, illnesses. They don't help in diagnosing headaches, bunch or strain type migraines. A CT sweep or X-ray can assist decide whether your cerebral pains are associated with an issue with Dr. Cradle to Grave. Be healthy.